now we are joined by Dr. James Dasher of Novant Health's Bariatric Surgery in Kernersville. And we've talked before about the benefits of bariatric surgery, but we're talking today about the lifestyle changes that are required for success after that surgery, or any major surgery, right?
Absolutely, and the easy part is the surgery, and the hard part is the commitment to the lifestyle change afterwards. Our patients have to really concentrate on the dietary component, and it's gotten a lot of press about protein in diets, and we really like our patients to have a good 80-90 grams a day for our women, and 100 or more grams depending on our male patients. Really is essential in making sure they lose the right kind of weight and not just muscle mass.
What about exercise?
That's part two. You can't have one without part two. All of our patients we encourage to be very fit. We need at least 3 days a week where they do weight training, and that can be bands, it can be free weights, it can be Nautilus machine, and then at least a couple other days during the week where they do aerobics. And that way we train the muscle to, keep the body to keep the muscle on, and patient to get stronger as they lose weight.
And what kind of tests do you do after the surgery?
All of our patients at 6 months will have a nutritional panel run, and then we run them in another 6 months at the 1 year mark, and then every year thereafter to make sure enzyme levels, their protein levels, their iron levels are all staying healthy.
And what about support after the surgery?
Second Tuesday of every month we have a support group meeting. Usually 60-70 people attend. We have a very active support group in Kernersville, and happy to have somebody come by anytime. You don't have to have already had surgery in order to come.
So you're not all on your own with this?
Correct.
All right, so now there's a lot of controversy about the cover of this month's Runner's World magazine that has a plus-size runner and talks about being fit at any size. So what are your thoughts on that?
Well, I think it's a little deceptive because from what I understand, plus size is 12 or above. And you can certainly be very fit at 12, 14, whatever those sizes might be. The real question is, what's your body mass index? Because that's where we have the medical science to back us up. And if a woman is a, quote, plus size, but her body mass index is probably greater than 30, it's hard to be healthy with that. There's a reason at 40 we call it morbid obesity, meaning you've got a lot of serious health risks coming up. So I think it's great to say you can be healthy at any size, but we really want to use the doctor's sort of guidance to make sure that we're at the healthy BMI and staying healthy long term.
All right, well, I'll talk to you a little bit more about that after we're off camera. Thank you so much. We do appreciate it.